We're here at the 2025 ASCO Gastrointestinal Cancer Symposium. Just want to talk about 3 abstracts that I want everybody to be aware of. This data is emerging, so we're not going to talk about results, but we want to talk about 3 studies that are reporting out that we just want people to be aware of, and then obviously as the results come out, we'll have more information to discuss. But the first abstract is CheckMate 9DW, and this was a study looking at the frontline treatment for patients with advanced hepatocellular carcinoma or liver cancer. And this study was looking at nivolumab and ipilimumab, the combination of 2 immunotherapies, and really comparing that immunotherapy regimen to what was considered at the time to be frontline, first-line therapy for HCC, which was sorafenib or lenvatinib. This type of expanded kind of analysis of this study will give us some more insights into the true activity of nivolumab and ipilimumab in a frontline setting for patients with metastatic or advanced hepatocellular carcinoma, and we'll be able to kind of see some of the characteristics of which patients may have responded the best. The other 2 studies that I want everybody to be aware of are actually 2 studies in colorectal cancer. So the first one is a practice-changing abstract and research study called BREAKWATER. Now we know that BRAF V600E mutations are present in about somewhere between 5 to 10% of patients with metastatic colorectal cancer, and we know that there's a targeted therapy regimen that is already FDA approved for patients with BRAF V600E metastatic colorectal cancer, and that's a combination of encorafenib and cetuximab. What BREAKWATER is a frontline study. So it's the combination of chemotherapy, FOLFOX chemotherapy, which is one of the most common regimens given for metastatic colorectal cancer. And in patients with the BRAF V600E mutation, they're adding in encorafenib and cetuximab, and they're comparing that to standard of care chemotherapy. This is a practice-changing abstract because we already know that there's an FDA approval of FOLFOX in combination with encorafenib and cetuximab for patients that are BRAF V600E mutated and have metastatic colorectal cancer. So we're going to look forward to those results to see what the data actually shows in terms of what was the overall response rate and an early look in terms of what overall survival looked like. And then finally, the CheckMate 8HW study was a frontline study in patients with metastatic colorectal cancer that were MSI high or deficient in mismatch repair. And this study was looking at 3 arms: nivolumab in combination with ipilimumab, so combination immunotherapy, nivolumab alone, or standard of care chemotherapy. And what we know from the study is that the nivo plus ipi arm already was reported out to have done much better than the chemotherapy arm. What we're looking for in this abstract is the efficacy of the combination of nivolumab and ipilimumab versus single agent nivolumab. And the reason why we're looking forward to those results is because if nivolumab and ipilimumab is better or are better than nivolumab as a single agent, that will also be practice changing.